हेलो एवरीवन, दिस इज़ डॉक्टर रवि मीना। अभी काफ़ी कन्फ्यूज़न चल रहा है लोगों में नीट पीजी काउंसलिंग को लेके कि वेदर दे शुड चूज एमडी पैथोलॉजी एज अ करियर और नॉट। आई एम अ प्रैक्टिसिंग पैथोलॉजिस्ट। आई हैव completed my MD pathology from Gandhi Medical College Bhopal in 2020. After that, I have joined or worked in some corporate chain like Dr. Lal Path Lab in Bhopal. Then I have joined HBCH or Mahamana Cancer Center in Varanasi, which is a unit of Tata Memorial Cancer Hospital, Mumbai. And currently I'm working in Indira Path Lab, Varanasi as a lab head. So I have a total experience of 5 years after post MD, and what I think one should choose or avoid the MD pathology. So I have set certain pros and cons, particularly what I have experienced through all these years. So the pros are to choose MD pathology as a career. Pros of MD pathology और पैथोलॉजी एज अ करियर। फर्स्ट जो मुझे चाहिए था और जो मोस्ट ऑफ दी लोगों का रीज़न होता है, आई थिंक दैट इज़ अ ब्रिलियंट वर्क लाइफ बैलेंस। मोस्ट ऑफ द टाइम 8 to 9 आवर्स का आपको काम करना होता है, वेदर इट इज़ गवर्नमेंट और प्राइवेट सेक्टर। दिस इज़ द मैक्सिमम आवर्स दैट यू नीड टू प्रोवाइड योर वर्क। अब मोस्ट ऑफ द टाइम इमरजेंसीज नहीं होती हैं। हाँ, रेजिडेंसी के टाइम पे थोड़ा इमरजेंसी होती है, बट वो भी इतना हेक्टिक नहीं होती। सो दिस इज़ वन ऑफ द पॉइंट कि मोस्ट ऑफ द कॉलेजेस में रेजिडेंसी इतनी टॉक्सिक नहीं है। आई थिंक बहुत ही अच्छी है, ईजीली निकल जाता है। सो वर्क लाइफ बैलेंस इज़ द फर्स्ट पॉइंट एंड आई थिंक द मोस्ट इम्पॉर्टेंट पॉइंट in the favor of taking MD pathology as a career. After the work-life balance, pathology is very academically driven branch. बहुत सारा पढ़ने का होता है। पैथोलॉजी इज़ अ वास्ट सब्जेक्ट। अगर आपको पढ़ने में ज़्यादा इंटरेस्ट नहीं है, इफ़ यू आर नॉट अ बुक वर्म, सो you can consider this as a cons of taking MD pathology, because there are so many regular updates जिनसे आपको up to date रहना होता है. So I think you have a lot for research. So one can consider this as a pro or cons. I particularly love reading, so I consider this as a pros of taking MD pathology as a career. And the third and particularly my favorite point why one should take MD pathology as a career is if you have an entrepreneurial mindset. So pathology gives you the opportunity to build your empire with a low budget particularly. So you can build a business with low budget. I'm particularly talking about tier 2 and 3 cities. Tier 1 is usually saturated and the cost of land and rental things is usually high. So I'm particularly talking about tier 2 and tier 3 cities where you can practice easily, and usually every business runs by demand and supply. तो tier 2 और tier 3 में काफ़ी डिमांड है अभी भी. So you can easily establish your business. Definitely you must have an entrepreneurial approach and mindset. थोड़ा मेहनत तो उसमें लगेगा ही लगेगा. And before starting your business, you better work in some good corporate hospital or a corporate diagnostic chain to gain some basic knowledge of the business. Nonetheless, ये एक separate topic है, but these are the 3 pros that I feel one should take MD Pathology for a good work-life balance, and this is an academically driven branch, so you have a lot to study and you can build a business with comparatively low budget. Now we will see the major cons of taking MD Pathology as a career or pathology as a career. So the biggest con is there is almost zero patient interaction. So most of the pathologists are the background, they are the background doctors. Basically we are the directors of a movie, so we do not perform on the front stage. But yes, in today's scenario, the most of the treatments are given on the way. As we know, we are practicing medicine in a evidence-based medicine era. So pathology has a huge or significant role in a treatment, but ये दिखता नहीं है, दिखता वही है जो सामने ट्रीटमेंट दे रहा है. तो ये थोड़ा इसका साइड क्या बोले कौन सा है कि आपको रहेगा थोड़ा लैक ऑफ अप्रिशिएशन और उतना एडमायर भी नहीं करते लोग. मोस्ट ऑफ द पीपल इन सोसाइटी तो पता ही नहीं होता है कोई पैथोलॉजिस्ट होता क्या है. बहुत सारे लोग आपको कंपेयर कर देंगे कि ये जो लेबोरेटरी टेक्नीशियन होते हैं, नो ऑफेंस टू देम, बट थोड़ा आपको लगता है अरे नहीं भाई मैंने MBBS किया है, MD किया है, हम लोग अलग हैं. बट ठीक है, ये एक साइड इफ़ेक्ट है इसका. कौन सा है कि पेशेंट इंटरेक्शन नहीं है तो उतना अप्रिशिएशन भी नहीं है. सेकंड इज पेमेंट और सैलरी. तो पे चेक थोड़ा इसमें रिलेटिवली कम होता है, और वो भी जो टॉप टियर ब्रांच हैं लाइक इंटरनल मेडिसिन, रेडियोलॉजी, ऑब्स्काइनी, पीड्स, ऑर्थोपेडिक्स, इनसे थोड़ा सा कम होता है. इतना भी कम नहीं होता है, मतलब डिसेंट अमाउंट ऑफ मनी आप यू कैन अर्न ईजीली. मतलब 2-3 lakhs तो ईजीली कोई भी अर्न कर सकता है Tier 1 Tier 2 में ईजीली. And the third cons of taking MD pathology is saturation in Tier 1, particularly for MD pathology. You need to do some fellowship or some super specialization like PDCC or DM courses to stay relevant in particularly Tier 1 cities. But in Tier 2 and Tier 3 there is still a very good demand of pathologists, and you can easily establish your business in Tier 2 and Tier 3 cities. Now I want to discuss about one of the very important point that most of the people miss out. What is the pay after completing MD Pathology, DNB Pathology? So it vary, but usually a fresher can earn from 1 to 2 lakhs per month depending upon the sector you choose. If you work or you start working in the government setup, then usually you start with the SRship. So the stipend is somewhere between 80 to 1 lakh, and it's depending on the state or the central government or the any private organization that you have joined, उनका क्या पे रहेगा accordingly. But in private Tier 2 Tier 3 cities you can get up to 2 lakhs per month in a corporate chain and in some corporate hospital. So it depends कि आप कहाँ पे ज्वाइन कर रहे हो और आपका प्रायोरिटी क्या है. If you want to earn money, then rather join a corporate hospital or a diagnostic chain. They provide higher salaries from the very beginning. But I personally recommend first complete the SRship. At least complete 1 year of SRship before joining any private sector. This will help you to evolve as a pathologist, because in the JRship and in MD Pathology we mostly read about the things, but how to practice, how to release reports, this we learn in SRship. So it's better to complete SRship. It will be great if you complete SRship of 3 years, but at least complete SRship of 1 year from a good organization if possible. So this is the initial or entry level pay for a MD or DNB pathologist, and down the year it depends whether you are going to start your business, or you are going to stay in a corporate chain, or you are going to join a government sector. So pay vary according to the sector you choose. In the business there is no limit. You can earn crores of rupees if you have that mindset, but there are challenges of business. It's not necessary that it will run as you expect. It might fail. So before running a business, it is recommended that you should work in corporate chain or a corporate hospital to take a basic learning, how to run a diagnostic chain, how to run a healthcare setup. And after that, if you feel yes, you can do this and you want to do this, then start your business with a pilot project. That's a separate discussion. We'll discuss later on in some other video. So in the business there is no limit of earning, but in job usually it varies, and the upper bracket of in most of the jobs 3 to 3.5 lakhs in the corporate sector or private sector, and government sector as per the government policy. So this is about the pay. And one more option that I want to discuss is super specialization option after MD Pathology or DNB Pathology. Look, there are so many options of super specialization. Like you can join PDCC, you can join a fellowship program, you can join a DM program. DM programs are available in oncopathology, histopathology, hematopathology, and I think some of the organizations are also offering DM program in cytopathology. And similar programs are available for fellowship and PDCC also. PDCC is also available in renal path, and particular system wise, like you have a PDCC program in renal path, in liver path. If you are planning to establish in a tier 1 city, then it is recommended that you should at least have one of them, either PDCC, fellowship or DM after MD Pathology. For tier 2 and tier 3, MD Pathology is enough, and 1 or 2 year of SRship after MD Pathology is good enough to practice. So I can make a separate video on super specialization after MD Pathology. If you want, please do comment regarding this. Now, one of the most important thing that we miss out before joining any specialization course, that is what are the career option or what are the job options, or I should say career options after MD Pathology. So what are the career options? I'll divide this in certain categories. First is medical college job. Like you can join a government medical college, whether central government or a state government medical college, or a private medical college. Usually there are saturation in government medical college, particularly of the aims and aims like organization. So you need to be very good at your work, and your CV is exceptional to get a job in aims and aims like organization. For a state like medical college, you can get the job relatively easy, in a easy way. So just complete your SRC 1 or 2 year and you can get a job in most of the state medical colleges. In private colleges it is very easy, or I should say relatively very easy to get a job, but the pay is not as good as the government medical colleges. Other career option is in the government sector. One can join central government via CMS, or state government. State government offer so many programs like NHM, Directorate of Health Services, and direct class 1 vacancies in certain states. So these are the options in government sector. Like you can join after qualified for CMS and state government, NHM, DHS and class 1 jobs. And third and my favorite option is private sector. In the private sector, you can join corporate hospitals. They will pay you higher from the very beginning. They pay almost twice as government or other medical college payment. So there is a very good pay at the corporate hospital and the corporate diagnostic chains like Dr. Lal Path Labs, Metropolis, Pathkind, Redcliffe. There are so many diagnostic chains, and if you start working early, then there is a lot of chance that you could get a very good position in that organization, like regional head, zonal head, or even a national head, if you work for 8 to 10 years in that particular organization. And usually there is a very good work-life balance on 8 to 9 hours of working, and good amount of leaves is there. Last but not the least, a career option is build your own business. Build your own business, like set your own lab. This will take a separate video. If you want, I will discuss this later on. Thank you. Hope this information will help you.